Muchas gracias por asistir. Voy a presentarla muy breve para que ya pase directamente a su presentación. Este es el último seminario del año y tenemos el agrado de que Temini Jesús esté con nosotros. Ella tiene como primer grado una licenciatura en bioquímica y posteriormente hizo una maestría en metabolismo molecular de fármacos y toxicología. Y actualmente es estudiante del doctorado de Ciencias Biológicas que se imparte o que es parte de la Universidad Autónoma de Tlaxcala. El supervisor de este trabajo es el doctor Gabriel Rotán, que esperemos nos esté acompañando. Bien. Bueno, adelante, Temígenso. Muchas gracias por venir. ¿Tienes agua sin preguntas? Nada más déjame asegurar que funcione. Listo. Muchas gracias.
Buenos días a todos. Perdóname, voy a presentar en inglés.
Adelante.
Me siento más cómodo en inglés. I'm going to present a little part of my thesis. I've been working on this project for the past 2 years. I started from here in Laboratorio de Neurobiología. Then when the 5th floor was undergoing remodelation, I had to go to Instituto de Neurología y Neurocirugía, Manuel Velasco Suarez. So it's a collaboration between our lab here and over there.
The microphone isn't working properly.
Well,
No, you.
the one here?
Yeah.
So today, my thesis and my project is basically about the negative side effects of chemotherapy. I don't know, maybe anyone has seen it online. I've seen it several times in comments on Instagram, on Facebook. People say, don't take chemotherapy. Chemotherapy is going to kill you. When you take chemotherapy, you are going to feel bad. And people leave their treatment, and some people die because they discontinue their treatment. Therefore, it's important to minimize the side effects of chemotherapy so that people can take their treatment and get better. I was particularly interested in these statistics, and I checked some papers. The first one is cancer misinformation. What they basically did in this project was to check real information about cancer and wrong information about cancer. And they discovered that the same number of people were consuming both real and unreal or misinformation about cancer. And this is dangerous because these people go to tell their family members, their friends, and they tell them, no, don't take chemotherapy, it's going to make you feel bad. One of the major side effects associated with chemotherapy, there are a lot of side effects, but one of the major side effects is low muscle mass called cancer cachexia. But apart from cancer itself, chemotherapy can also cause muscle atrophy. And in a particular study that I also got interested in, the reason why people discontinue chemotherapy in GIT cancer, in 114 patients that they were able to monitor, they discovered that they had a lot of side effects like asthenia, cachexia, occlusion, just to mention a few. But the part that was particularly interested to me was that in the last 3 months of life of this patient, 69% stopped taking chemotherapy. And in the last month, 26% stopped taking chemotherapy. And very interestingly, these people that discontinue chemotherapy die 65 days after stopping chemotherapy. Therefore, we need a little bit of introduction on what chemotherapy is. And according to WHO, 1 out of 6 deaths is due to cancer. A lot of people die from cancer. But thanks to the research carried out by researchers, clinicians, there are several ways by which cancer can be treated. Immunotherapy, surgery, chemotherapy. But we're particularly interested in chemotherapy. Chemotherapy is the modality of cancer treatment that uses toxic drugs to destroy cancer cells. But in the process of destroying these cancer cells, normal cells also get destroyed. And when these cells get destroyed, we have a lot of side effects, which include fatigue, hair loss, kidney problems, mood change, brain fog, in which we are particularly interested in, is popularly called chemobrain or chemotherapy-induced cognitive impairment, and also muscle pain and muscle atrophy. Cisplatin is one of the common drugs that is used in chemotherapy. It is a platinum-based drug, and it is particularly useful in the treatment of solid tumors. For example, breast cancer, prostate cancer, cervical cancer, just to mention a few. And like other chemotherapies, cisplatin also have so many side effects, in which chemobrain is one, cachexia, ototoxicity, and others. Now, like I said, chemobrain or chemotherapy-induced cognitive deficit is not new. This has been on for so long, but why are we interested in it? The major reason is because up till now, there's no particular drug that has been identified or used in clinic to reverse the cognitive damage that's associated with chemotherapy. And people suffer so many years, even after they have stopped taking chemotherapy. It affects their quality of life, it impacts it negatively, and therefore it is a major source of concern. Because it is not a new phenomenon, so many research has been done on this topic, and these are some of the major mechanisms by which researchers have told us that chemotherapy can cause chemobrain. The first one is the reduction of neurogenesis and glycogenesis. Neurogenesis is the process of producing new neurons. Just to make it simple, these new neurons are produced from neural stem cells. But in an adult brain, the neurons are mostly postmitotic, that is, they are fully differentiated. Therefore, neurogenesis is only restricted to just a few locations in the brain. That's the subventricular zone and the subgranular zone in the hippocampus. Not all chemotherapy drug can cross the blood-brain barrier, but cisplatin can cross the blood-brain barrier in little quantity. And when it does, it gets deposited in the hippocampus, which is one of the major signs of neurogenesis in the brain. And when this occurs, apoptosis occurs, and there's a death of neurons, and there's a reduction in neurogenesis, which can lead to memory problems. The second one is a reduction in spine and dendrites. Dendrites are very important in receiving information and transmitting this information in the brain. And when there's a reduction, it causes a reduction of the gray matter, which can lead to problem with focus, with working memory, and verbal ability in some cases. Another one is reduction in neurotransmitter. This is not very common, but some chemotherapy drugs have been shown to cause reduced neurotransmitter production in the brain. But finally, one of the most common one is increased reactive oxygen species production and increase in the production of pro-inflammatory cytokines like NF-kappa, BT, NF-alpha, and so on. And this helps to maintain this cognitive deficit for a long time. This is the general scheme in which chemotherapy drug can cause chemobrain. But in the case of cisplatin, the major way it causes its own chemobrain is through 1, 2, and 4. That is, it causes a decrease in neurogenesis. It can also cause DNA cross-linking, leading to apoptosis. It can increase ROS and pro-inflammatory cytokine production, and also causes a reduction in spines and dendrites. Apart from, one of the reasons why we decided to venture into this project is because, like I said, people have done a lot of work, but the picture is not complete, because if the picture is complete, there should be a specific drug that can treat this condition. So we believe that some information are missing, and we need to identify this information. And also, we're not only interested in knowing the method or mechanism by which cisplatin can cause chemobrain, we also wanted a small therapeutic drug that can reverse the side effects that we've seen. And we decided to go with N-acetylcysteine, popularly called NAC. This drug is an antioxidant. It's popularly used by athletes to build their muscle, and also it is used in clinics for treatment of pulmonary disease. It has also been investigated for mental disorder like schizophrenia. Is undergoing clinical trials. So NAC is a drug that is very good. It has been investigated and used, and it has been said to be good for general wellness, lung health, heart health, immune function, and so on. Apart from the fact that cisplatin can cause neurocognitive deficit, cisplatin also causes a condition known as muscular atrophy. For example, in this image here, you can see a healthy man, and when he had muscular atrophy due to cancer, cachexia, this is what it looks like. This condition is characterized by a reduction in muscle mass. And cisplatin can cause this condition by altering the redox habits. It can also inhibit myogenesis. It can cause mitochondrial injury and also alteration in the homeostasis of calcium. What we know is that NAC N-acetylcysteine also can balance ambient redox and help to increase myogenesis. So we thought it might be a good drug to investigate. Monday.
Just one, if I may, the small caveat, if I'm not mistaken, the only well-established FDA-approved use of NAC is in lung disease. And the other 5 are currently under investigation, right?
It is also used in heart disease. In fact, in heart problems.
Heart disease, okay, I thought it only in lung disease, okay, I didn't know that.
They use about 600 milligram per day
Okay,
to 3,000 milligram per day, depending on the severity of the illness, from 6 months to 3 years.
okay.
And there's no side effect. The only side effect is nausea in some patients and diarrhea. So it is used for heart problems.
Okay, I thought it was in lung disease, so I need to update. Okay, thank you very much, okay.
So a little bit of background to our study. The first thing,
Sorry. I think it's also a treatment for acetaminophen.
overdose.
Oh,
There we go.
yes.
So one of the background study that we decided to check was the one in which cisplatin was investigated for cognitive deficit, and they used the novel object recognition test, which we also use. And what they discovered that cisplatin can cause the rat not to have a discrimination between familiar and novel objects. Also, in another project that was conducted on the effect of cisplatin on muscle atrophy, they discovered in this particular project that cisplatin significantly reduced muscle grip strength. So all of these are known, like I said. What is the new information we want to bring to this field of research? Then we began to ask ourselves, our 2 major investigative questions was to know if the neuroprotective effect of NAC in cisplatin-induced cognitive deficit is due to its ability to modulate kynurenic acid levels in the brain. And also wanted to know the effect of NAC on the muscular atrophy induced by subchronic administration of cisplatin. So I talked about kynurenic acid, and this is what I did. Cisplatin, like I said, can cause oxidative stress, can cause inflammation, and when this occurs, can lead to astrogliosis, which is the way by which the brain reacts to injury. And when there is astrogliosis, one thing happens, which is very important. This is the production of kyna. Kyna, or kynurenic acid, is a metabolite of the catabolism of tryptophan, which is a very important amino acid. But why is the metabolite of tryptophan important? They are very important because they are neuroactive. Kyna, for example, is an endogenous antagonist of the NMDA receptor and the alpha N7 acetylcholine receptors, which are very, very important in learning and memory. So when cisplatin is given, we know that it increases oxidative stress, and in theory, when oxidative stress increases, kyna should increase. So we also know that NAC, according to this research that was carried out, they discovered that NAC has the ability to inhibit an enzyme called kynurenine aminotransferase 2, CAT2. This is the isoform present in the brain and is the enzyme that converts L-kynurenine to kyna. So if NAC can inhibit this enzyme, then we hypothesize that there should be a reduction in kyna, and there should be like an improvement in learning and memory. Therefore, the objective of this project is to determine the effect of the modulation of CAT2 and cerebral kyna through NAC in the cognitive decline induced by subchronic administration of cisplatin, and also to evaluate the involvement of myogenic microRNAs in cisplatin-induced atrophy. So our experimental design, we use female rats between 230 and 260, and randomly we divided them into 4 groups. The first group is our control group. They were given sodium saline metaperitoneally for 5 days. The second group was given 3 milligram per kilogram cisplatin for 5 days. The third group received 300 milligram per day NAC, but this time not through injection, but in their pellet, so they took it orally. The last group was pre-treated with NAC for 3 days, and they had a co-treatment of NAC and cisplatin for 5 days, making a total of 8 days. So after this, the rats were allowed to undergo recovery of 5 days. We had 2 different groups. We had a group that we evaluated for cognitive decline, and we also had the second group that we evaluated for muscle deficit. So we did the novel object recognition test, which generally has 2 days of habituation. Then we did the training and test. The rats were sacrificed 24 hours later, and we did the biochemical analysis. Our results. The first thing we were interested in checking is the body weight of the rat. And this was the first day of treatment. By the 3rd day, the rats that were given cisplatin had already started to experience a significant reduction in body weight up until the 5th day. They were allowed to rest for 5 days before undergoing habituation for 2 days, making a total of 7 days. And these rats had been able to recover their body weight before starting the experiment. Also, in the group of rats that were administered with NAC and cisplatin, they also began to experience a significant reduction in body weight on the 4th day, and they also regained this body weight after a week of rest. Our first result was in an experiment that was used to investigate the effect of cisplatin on cognitive deficit. And the name of this test is the novel object recognition test. In the novel object recognition test, a box is placed in the behavioral room, and the rats are allowed to acclimatize in the process of habituation for 10 minutes per day for 2 days. Then on the 3rd day, which is the first day of test, we give them 2 identical objects, same shape, same color, same size. They are allowed to explore this object for 10 minutes, and we check their discriminatory index. What we expect is that the rat would explore the object the same, like 50%, because it's the same object. Then we do the short-term memory test an hour after this. Basically, what we do in the short-term memory test is that we change the object A prime, the familiar object, for a new object B, different color, different size. And what you will expect in a rat that has no cognitive deficit is that they explore more the object B, because for rodents, they have an innate preference for novelty. Then 24 hours later, we do the long-term memory test, in which we change one of the familiar objects for another novel object. And what you will expect in a rat that is not cognitively compromised is that they explore the new object more than the old object. What we discovered was that during the long-term memory, the cisplatin treated rat had no discrimination, like the discriminatory index was around 50%. That is, they show no preference for the novel object, which shows us or suggests to us that there's a cognitive deficit. After this, we decided to check the redox environment and the ambient. And what we did was that after sacrificing, we homogenized the samples and we carried out the experiment. The first thing we did was to check the MDA levels. MDA is also called malondialdehyde. It's the end product of lipid pyroxidation. So when there's a high MDA level in the system, it suggests to us there's oxidative stress. And just like we expected, cisplatin caused an increase significantly in the level of MDA in the brain. Then also we decided to check the reduced and oxidized glutathione levels in the brain. One of the things I forgot to say earlier is that NAC is a precursor for reduced glutathione, and this is a very important antioxidant in the system that helps to balance the redox environment. Therefore, we checked and we discovered that cisplatin significantly reduced the ratio of reduced glutathione as compared to the oxidized glutathione, which shows us that cisplatin moves the system towards a pro-oxidant state, and that co-treatment with NAC can reverse this condition to levels even greater than what we found in control. Also, I spoke about kinin, which is a very important neuroactive metabolite in the brain that is an endogenous antagonist of NMDA receptor that is important in learning and memory. And what we discovered was that cisplatin causes a very significant increase in kinin levels, and pre-treatment with NAC was able to reverse this. And also in the activity of the enzyme that produces kinin, kynurenine aminotransferase 2, there was a significant increase in the activity of this enzyme, which was reversed with treatment with NAC. So in the area of immunofluorescence, we decided to check what was going on in the brain. And what we use the anti-MyoPen, which is a biomarker of neuronal differentiation. We also use the anti-GFAP, which is a biomarker of astrocyte activity. And what we discovered in cisplatin in comparison with control, for example, in control, you see a lot of green fluorescence, which is significantly reduced here. And you also see a bit higher fluorescence, the red one, which signifies astrocytic activity, which is decreased here. It signifies to us that there's a reduction in neuronal activity and astrocytic activity in cisplatin-treated rats, and this was reversed with co-treatment with both NAC and cisplatin. So when we finished with the brain aspect, we moved to the muscle aspect. I'm going to be playing a video. On my left, you have the cisplatin-treated rats, and on my right, you have the rats that were treated with both cisplatin and NAC. And after treating them, we decided to do an experiment known as wire hanging test. And after the experiment, I'm going to be explaining. This is the cisplatin-treated rat. And you see that their latency to fall is very low. This is the cisplatin plus NAC.
Oh. That's cool. Wow. I think you made your point.
Exactly. So there was about a twofold increase in the latency. So these are the results graphically. You will see that cisplatin caused a significant reduction in grip time in this particular wire hanging test. And in the co-treatment group, there was a reversal of this effect. Apart from the first experiment I showed you, we also did another experiment in which we used an object known as the muscle grip meter or the nanometer. It's also used in the clinic to assess muscular strength. And what we discovered was also similar, that cisplatin caused a significant reduction in strength of the rats that were treated with cisplatin, and that treatment with NAC causes a reversal of this condition. After we sacrificed, we decided to take the tricep muscle of the rat, and this is a representative image. In the cisplatin-treated rat, we saw that decrease in the muscle mass, and the group that was given NAC was able to recover, just like you can see here in the image. Then we also did the immunohistochemistry. This is just a qualitative experiment in the quantitative one. But what we can see here is that in the rat that were treated with cisplatin, there was a deformation in the muscle fiber. In normal muscle, you have like a pentagonal or hexagonal shape of the fibers. When the cisplatin-treated group, you have decrease in the fiber density and also a deformation in these muscle fibers. And in the group that was treated with cisplatin and NAC, you can see that there's a partial recovery of this. Okay, so the little I know, I'm not an expert in stoichiometry actually, but what you can see here are muscle fibers. So in a control rat, they have like a pentagonal, like a 5-side or hexagonal shape. But here you will see that there's a deformation in the shape and there's an elongation. And when this happens, it causes a reduction in the density of the muscle fiber as compared to the control group. And also, although we could not find a significant difference, we tried to count the number of cells. There was a trend towards reduction in the cisplatin-treated rats, but it was not significant actually. But physically, we can see structural alteration in the cisplatin-treated rats. And in the group that was given NAC, you can see that the fiber look sort of similar to what you can find here as compared to this in the shape. So we also decided to check the redox environment in the module, and we checked the glutathione, the reduced and the oxidized glutathione ratio. And we also found something similar, that cisplatin caused a significant reduction in the ratio of reduced to oxidized glutathione. Apart from this, we decided to check the enzymes that are involved in this circle. We have the glutathione peroxidase and the glutathione reductase. What the glutathione peroxidase does is that it converts reduced glutathione to oxidized glutathione in the process of I'm looking for the word in English. In the process of neutralizing the reactive oxygen species. For example, here I have the hydrogen peroxide, which is an ROS, and glutathione, what it does is that it causes a conjugation between this and the reduced glutathione to give us the oxidized glutathione, and the glutathione reductase does the opposite. So what we can find here is that cisplatin causes a significant increase in the activity of the glutathione peroxidase, which shows us that the system is moving towards a pro-oxidant system. That is, there is more of the oxidized glutathione as compared to the reduced glutathione. But interestingly, cisplatin also causes an increase in the activity of glutathione reductase, which shows us that the body is trying to neutralize the oxidative insult. And also in the process of NAC and cisplatin, the rats that were given NAC and cisplatin, there was no significant reduction. And this caused us to ask the next question. If there's no significant reduction here and the rats seem to be getting better, what exactly is happening in the system? What exactly is NAC doing? We also did another test using the MTT reagent to check the cellular function, and we discovered that cisplatin causes a significant reduction in cellular function, and that co-treatment with NAC reverses this condition. But we are particularly interested here. This is the MDA level of in NAC and cisplatin treated rats. But what we discovered is that in both control and NAC, they had similar MDA levels. So NAC is not actually reducing the MDA levels as we thought earlier. So we decided to carry out an ex vivo experiment between the control group and the NAC group. And this is what we can see here. What we did is that in the tissue homogenate, we added another oxidant, which is known as the ferrous sulfate. And what we discovered that in control and NAC, without ferrous sulfate, they had the same level of MDA. But when we introduced the FeSO4, we discovered that there was a 4-fold increase in the MDA level. But in the case of NAC, there was no significant difference. So this suggests to us that NAC prepares the body to withstand oxidative assault. When there's no oxidative assault, NAC rat or NAC system would behave like a normal control system. But when there's an oxidative assault, NAC helps the body to withstand this oxidative assault. And also, we decided to check the expression of microRNAs. This is something different, and this is the first time this will be investigated. MicroRNA are small non-coding RNA that are very important in several cellular functions, and they carry out their effects by down-regulating their gene of interest. So there are 8 groups of microRNA that are known as the myogenic microRNAs. The myogenic microRNAs are microRNA that are involved in myogenesis. So we decided to check the expression of 3 of these microRNA. The first one was the MIR1, the second one was the 133A, and the third one was the 206. We discovered that 2 out of these 3 microRNAs, cisplatin, reduced significantly the expression of this microRNA, and that treatment with NAC was able to reverse this condition. But in the case of microRNA 206, there was no significant difference between cisplatin as compared to control, but it shows a downward trend, and also it was reversed. There was a trend for reversal with co-treatment with NAC. Like I said earlier, microRNA can target their gene of interest, and in the case of microRNA 1, the gene of interest is histone deacetylase 4, and also the gap junction protein known as the connexin 43. You will find out that there's a negative trend. For example, here, the microRNA was significantly decreased by cisplatin administration, but since it works in the reverse, you will find out that the gene of interest was significantly increased. The expression was increased, the HDAC4 and the connexin 43. And pre-treatment with NAC was able to reverse this high level of expression. And also in the case of SRF, the microRNA of interest is MIR206, and also there was a significant increase in the production of, there was a significant increase in the expression of SRF. So this work is quite large. We've been able to publish 2 papers. The first one is this one. This is the second one. For the purpose of this seminar, I just took out the major information, but if anyone is interested in knowing more, you can find this in these 2 publications. So in conclusion, I would say NAC counteracts cisplatin-induced neurocognitive and skeletal muscle toxicity by restoring redox homeostasis, by modulating kynureninic acid level in the brain, and in the expression of key myogenic microRNAs in the muscles. This finding highlights the potential of NAC as an adjuvant therapeutic strategy to mitigate chemotherapy-associated neurocognitive and muscle deterioration induced by subchronic administration of drugs. So I want to say thank you to members of my lab, the neurobiology lab.
Ah,
My tutor,
where is that? Oh, yeah.
Coach Miyoko. Yeah. So this is Dr. Gabriel, is my tutor. He's the one with the biggest lab. He's been so helpful. I'm thankful to him and members of my tutorial committee. And also, like I said earlier, I did the majority of this work in the Laboratorio de Neurobioquímica y Conducta in the Instituto de Neurología y Neurociencia Manuel Velasco Suárez, and also to my school, postgraduate in Ciencias Biológicas, Universidad Autónoma de La Scala, and to CONACYT that gave me the beca to be here to make this study. Thank you so much for listening. I'll take questions now.
Well, congratulations for your talk. Very, very interesting
Gracias.
topic, but I have a lot of questions, but you stated that NAC is an antioxidant, right? And with the microRNAs, you're looking the myogenic expression in the muscle cells, but does it cause like well, it's not atrophy as you're seeing in those groups that have only cisplatin, maybe do the same treatment, but if you're seeing an improvement with the NAC, what happens maybe with sarcopenia in elderly people? Is that can be a adjuvant treatment also for elderly people?
Okay, it would be wrong for me to generalize, but I know that athletes, for example, people that do sports, they take a lot of NAC because it helps in muscle proliferation and also regeneration. In humans, it has been investigated and it helps in reversing muscle fatigue. So what we know is that NAC is generally good for muscle health, but to be able to talk specifically on each muscle condition, for example, like sarcopenia, you have to investigate. In theory, it should be able to help muscle health generally, but it should also undergo investigation. And you might be interested to know that there's an investigation going on in where I'm working due to what we saw here. We are actually trying to make some new experiments in humans to see, for example, to see in people that have undergone some sort of muscle injury. They're actually planning to go to this place in Wyoming, past this government center for exercise, a Centro Cultural something, to check people that have muscle injury. They give some group NAC, some group will be without NAC, and to see if there's actually a significant difference.
But I mean, does it cause hypertrophy of the muscle because of doing the microRNA expression of myogenic?
Okay.
Does it? Is there any
there's no particular research, but in a system that has no injury, it can actually cause hypertrophy.
Oh, wow.
So that's why for athletes, it is not clinically or FDA approved.
Okay.
For the use in athletes, no. It's clinically approved for lung issues, for heart issues, but I don't know, maybe it's because of his ability to cause hypertrophy. It has not been approved for use in athletes or for exercise or for general muscle health. But in a system that has injury, in a system that is already in a disadvantage, right, if you give NAC, it can help them to make a recovery.
Thank you.
The proteins that are downregulated by the specific interference RNA. Why don't you fill the bloods I wanted
The
to.
Western blots, yes, we actually did Western blots. We checked transcription factors. We checked the effect of cisplatin on PGC1
Yeah,
and also on TIFAM. We got a conflictory result.
okay.
It's in the paper.
Okay.
A lot of people have reported that cisplatin caused a downregulation of PGC1, for example, but
Okay.
we saw an increase. And our hypothesis is because we sacrificed this rat 24 hours later after the experiment.
Okay.
So there's a possibility that the system is trying to compensate for the injury going on. But in cases of people that have done their own PGC and TFAM experiments in, say, 8 days later, they found a downward decrease.
Okay.
So I actually have the plots, but I didn't share them.
One question, the 8 days of constant treatment or 8 days after suspended?
No, the treatment was for cisplatin treated rats. They were treated for 5 days.
Yes.
But in the co-treatment group, we did a pre-treatment for 3 days. Because another thing about NAC is that it has a very foul odor. So
Oh.
a bad smell, yes.
Okay.
The smell is bad. So the rats, they don't want to eat when you give them NAC. So we gave them NAC 3 days before cisplatin because cisplatin also causes them to have loss of appetite. So when you give cisplatin and you give NAC, the rats don't want to eat.
That's why your initial result, I was so surprised because
Exactly.
there happened to be a synergic, okay, that has nothing to do with the.
No, it has nothing to
splatting
do.
in
No,
the
it's just
cacao.
smell. Just the odor.
Ah,
So that's why we did a pre-treatment that their body may be ready before we start giving cisplatin.
Okay.
So, and that was why we gave the cisplatin because NAC is also acidic. And we think that is why it causes diarrhea. When we started the experiment, the rats were having diarrhea. So we had to adjust the pH of NAC from 6 point something to 7. And it helped them to tolerate it more and reduce the dysentery.
So those are the 8 days.
Yes.
Awesome.
See, that's me.
Yes, the problem with the treatment with MAC in cancer patients treated with this could be that MAC will neutralize not only the side effects of this, but also the anti-cancer effects of this drug, and the cancer could come back in patients treated with both CIS and MAC. What do you think about this potential problem?
Thank you. That's my next line of research. I actually started this, and I started with an in vitro experiment. We took cell line from the glioma cell lines. We did U373, A182, and LN18. These cell lines are from glioma cells. And what we discovered was that when you give NAC and cisplatin together, NAC shows a tendency for increased proliferation, but this was not significantly different. There was no significant difference, but you can see a trend. So what we are doing right now is we are injecting rats with C6 tumor cells. We want to establish tumor in them and start this same treatment to see, because truly NAC is an antioxidant which causes proliferation. So it might actually make the cancer cell grow more. That's one. And also it may decrease the anti-cancer effect of cisplatin. So that is the experiment we are doing now, but in vitro, we've done this and there was no significant difference. Okay. And also NAC, the ability of NAC to be anti-tumorigenic is dependent on the dose as well.
Second question. Would NAC be better than other antioxidants?
I would say you can use any other antioxidants. And also, we should also use other cancer drugs. Apart from cisplatin, it would be good to use other drugs, maybe methotrexate, all of these drugs, but this research takes time and effort. So maybe postdoc, I don't know. Maybe we can continue with this line of research, but it would be interesting to use other, and some people have actually used other antioxidants as well. I know that of neurocognitive deficit, other antioxidants have been used, but I don't know that of muscle atrophy. Thank you so much.
Thank you so much.
Gracias.
Listo. Yes.
Ya fue la última del año, ¿no?
Ya fue la última del año, sí.